Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Kindly like, subscribe, and share for more. Ever wondered what the differences are between open and closed reduction techniques? Well, you're in for a treat, as we're about to embark on a journey through the intricate world of orthopedics. Open and closed reduction techniques are two primary methods used in the treatment of fractures, each with its own unique approach and application. Open reduction involves a surgical procedure to set bones, while closed reduction, as the name suggests, does not involve surgery and is often performed in emergency settings. The choice between these two techniques isn't arbitrary. It depends on a myriad of factors, such as the type of fracture, its location, and the patient's overall health condition. In essence, these techniques are like tools in a toolbox. Each one has a specific role to play and is selected based on the task at hand. Now that we've set the stage, let's delve into the specifics of these techniques. What exactly is open reduction and when is it used? Let's delve into this. Open reduction is a surgical procedure where a surgeon directly manipulates the bones back into their correct alignment. This isn't a simple push and pull operation, as it often involves the use of hardware like screws, plates, or rods to secure the bones in place. What makes open reduction stand out is its ability to allow direct visualization of the fracture site. This means the surgeon can see firsthand the extent of the damage and adjust the treatment plan accordingly. It's like having a roadmap guiding them to the best possible route to ensure the bones heal correctly. But why choose open reduction over less invasive methods? Well, it comes down to the complexity of the fracture. Open reduction is typically indicated for complex fractures that cannot be effectively treated with less invasive methods. These might include fractures with multiple bone fragments, or fractures where the bone has pierced the skin. Additionally, open reduction is often chosen for fractures with associated soft tissue injuries. Why? Because it allows the surgeon to address these injuries directly during the procedure, potentially improving the overall outcome for the patient. In conclusion, while open reduction is indeed more invasive than other methods, it provides a level of stability and control that can be crucial in treating certain types of fractures. Open reduction, while invasive, can provide stability and promote healing in certain types of fractures. Now, what about closed reduction? How does it differ from open reduction? Closed reduction, in contrast to open reduction, is a non-surgical procedure. Sounds more appealing, doesn't it? It involves the healthcare professional manually manipulating the displaced bones back into their correct position. No incisions, no surgical tools, just skilled hands at work. One of the key advantages of closed reduction is that it causes less trauma to the surrounding tissues. Think about it like this: if you had an option between a procedure that cuts into your skin, muscles, and tendons, and one that doesn't, which one would you prefer? Less trauma generally translates to less pain and discomfort post-procedure. But the benefits don't stop there. Closed reduction often means quicker recovery times too. With no surgical wounds to heal, patients can be up and about much sooner. So, when would a closed reduction be the best course of action? Well, it's indicated for simple fractures without any associated soft tissue injuries. These are fractures where the bone pieces are still relatively aligned and haven't punctured the skin. It's a bit like fixing a broken piece of pottery, aligning the pieces together without the need for glue. However, it's important to remember that every case is unique, and the choice between open and closed reduction will depend on several factors, including the specific type of fracture and the patient's overall health. Closed reduction can be a less invasive alternative for treating certain fractures, offering quicker recovery times. So, in the battle between open and closed reduction, who wins? Well, it's not so much a competition as it is a strategic choice. Both techniques have their strengths and their roles in treating fractures. Open reduction, with its direct visualization of the fracture, can be particularly advantageous in complex fractures where precision is key. On the other hand, closed reduction, being less invasive, can be a quicker and more comfortable option for patients, especially when the fracture is simple or non-displaced. Remember, the choice between these two is not a one-size-fits-all decision. It's a matter of evaluating each case individually, taking into account the specifics of the fracture, the patient's overall health status, and the potential benefits and risks associated with each procedure. So, it's not about picking a winner, but rather choosing the right tool for the job. Ultimately, the choice between open and closed reduction is a decision made by the treating physician based on the specifics of the fracture and the needs of the patient. UMCC, your ultimate medical consultant connectors.